Hi, my name is Dr. Janna Bentley. I'm the medical director of Lakeshore Vein Aesthetics Clinic. At this clinic, we treat spider veins all the way up to the big bulging varicose veins, and we want to welcome you. Varicose veins are not a normal part of aging. They have to do with a genetic condition and also to do with aging. And it's all about the tiny little valves inside the veins that are not functioning properly. So, depending on your ultrasound assessment, we will have set out a treatment plan. And we have a plan for the small veins, we have a plan for the medium-sized veins, and we have a plan for the bigger veins. For the small veins, you will be largely treated by our nurses because they are the experts in the spider veins and the reticular veins. But as you develop bigger, bulgier veins, because it is inevitable with aging and with something that is genetic, as are varicose veins, I may need to be called in for ultrasound guided injections. And with those veins, sometimes we need to actually assist the treatment and make it more effective by adding in something called tumescent anesthetic. And that's where we actually pump in a combination of saline and local anesthetic to make the veins respond better to the sclerotherapy. Now, if you have a truncal vein problem, a saphenous vein problem, and that traditionally would have been treated by stripping, in the last 35 years, we've had some non-invasive procedures come along, and they are incredible. They've totally revolutionized vein treatment. We have the thermal-based procedures, that's laser or radio frequency, and we will discuss with you that as an option. And then we also have the glue. So the glue is a very specialized treatment, and it works very well in areas where we might be worried about nerves and that kind of thing. So it allows us to safely treat past areas that we would have avoided because it does not hurt the nerves. So we've got the laser, radio frequency, and the glue that are options for the bigger truncal veins. And again, you'd be part of the treatment plan. We want your veins to be treated the best that we can because in the future we want our job to be easy. So if it's done well from the beginning, you will be happy and we will be happy and we'll be able to maintain this much better. As medical director of Lakeshore Vein Aesthetics Clinic, I want to ensure that you get the best quality vein care that you possibly can. So we've undergone very rigorous accreditation with the College of Physicians and Surgeons of British Columbia. We have to do this every 4 years, and it makes sure that you get the best treatment that you can. So you can trust our care and know that we will help you look after your veins for the rest of your life.